Now let's talk about external genitalia, and as you can see, it's pretty complicated here, but there's actually a lot underneath the hood. So let's break this down. So here we have our pubis mons pubis, and again, that's commonly known as the pubic mound. And then you see the urethral opening in the vaginal entrance and the anus. Now, what do we have here? So again, you have two sets of labia, and it's not really labeled that great in the book, but this part right here, this is what you call the labia minora or singular labia minor. And then you have the labia majora or labium major for singular. And again, labia majora bigger and on the outside, and labia minora as in the innermost part. And then we have the actual, so what is here? So you see this little flap of tissue, or actually sheath of tissue, and you can see it's torn. So this is the vaginal entrance, but there is a membrane called the hymen. And look at these hymen types. Now notice that there are many different shapes. So one of these hymens is actually a pathological condition and must be corrected. So which one do you think it is? So a common myth is that a hymen is just completely intact. But the thing is that if a woman starts puberty or a girl starts puberty, if she has an imperforate hymen that has no holes whatsoever, how is she going to drain the menstrual blood? So when you have a hymen that's completely intact with no holes whatsoever, they actually have to introduce even a small hole will allow for the release of menstrual blood. So again, this is why actually needs to be corrected. But why does this look really big? Parus introitus. Well, it looks very big because something very big passed through it. So what passed through it? Well, maybe after you give birth, well, what's that going to do? Well, you have a baby coming through this passage, so what's that baby's head going to do? And the rest of the body of the baby is going to bust through this. So this is what we see in women who have typically given birth. But all these other shapes, this is pretty common and are actually like this. Even though they're different shapes, again, a typical hymen does have even if a woman has not had intercourse, she will have some hole in there because why? You do need to get rid of menstrual blood every time you shed during a menstrual cycle. Now, what do we see here? So this is one thing I don't really like about your book. So the vestibule, and it's like, is it just the expanse? But actually, it's this entire area that's contained within the labia minora, but it's not at the vagina yet. So you're just at the entrance. You're not quite actually inside the vagina. And then you have these Bartholin's glands or greater vestibular glands, but they're often called Bartholin's glands. So as you can see, they kind of secrete into this vestibular area. In the bulb of the vestibule, and then we have the clitoris, and then this is the head of the clitoris, but the medical term is glans, just like the head of the penis is called the glans in men. And then you have the prepuce, and that's the common name is the clitoral hood. And prepuce is just analogous. It's like how the male foreskin, if there is one, is called the prepuce as well. That's the medical term. But the hood is, yes, the prepuce, and it covers the glans, the head of the clitoris. And again, I think this is a better picture of the vestibule. So as you can see, you're not at the vaginal opening is here, but the vestibule is this area that's not quite here at the vagina. So again, you have the labia minora separated right here. And you can see the clitoris. And this is really cool. So the thing about the clitoris, a lot of time, I mean, people know that it is an external organ. You can see it. But the thing about the clitoris, if you look underneath the skin right here, you can see the clitoris is actually a larger tissue. So this is the part you can't see. It actually skirts around here, around the bulb of the vestibule. So actually and the thing about the clitoris, and it's not coincidental that it also has a glans and prepuce. The clitoris is erectile tissue, and all of this can be engorged in blood. Just like the penis can be engorged with blood in men, this entire structure can also swell up with blood as well. Right. So then, again, the clitoris is not just external genitalia, it's both external and internal. So now let's go in and look at the internal anatomy. And what do we see here? Again, the vestibule is not quite here in the vaginal canal, and then you have the hymen in the various forms of intactness, and then you have the vestibular glands. And what we have here is the vaginal canal and the rugae. So you see that there's all these little ribs and folds. So this texture inside the vagina, these folds are called rugae. It's just like the rugae inside your stomach. And then you have the vagina fornix, so it's not quite here, it's this area surrounding this structure right here. And this structure is called the cervix. So cervix does sound like cervical, and this is what it comes from the same root word for neck, but this is like what the neck of the uterus. It's not quite at the uterus yet, it's the entrance to the uterus. So this is I guess the portal between the vagina and the uterus. So when we go past the cervix, now we're finally at the uterus. And what do we see here? Well, there's a lot of things that, okay, the uterus is connected with the logo with tubes to the ovaries over here. And uterine tube, that's I mean, you might have heard fallopian tube, that's a common term, but your book just calls it the uterine tube. I guess they're trying to take the names out of terms. But yeah, you should definitely know the uterine tube, fallopian tube, same thing. The thing about your uterus and ovaries, it's not just dangling here. Notice that there's all these ligaments. Like you have the ovarian ligament anchoring it to the uterus, the broad ligament linking the ovaries and the fallopian tubes to the rest of the body of the uterus. So you can see that there's many ligaments that hold the uterus in place. Now, what do we have here? So here we have a Pap smear procedure, and what is happening here? So then you see that there's an instrument being inserted here called speculum, and then a brush is being guided with that speculum into the vagina and swabbing the cervix. So what is a Pap smear? Well, this brush is going to obtain a sample of cells from the surface of the cervix, and then this is what speculum looks like. So they actually insert this into the vagina to hold it open and allow the brush to go through, and for the gynecologist to take a sample of cells from the surface of the cervix. And from what women tell me, no, they do not warm it up. Like if I was a gynecologist, I would like put the speculum on a hot water bottle. I can't imagine putting cold steel inside any part of my body. So yeah, I feel I'm grateful that I don't have to do Pap smears, but yeah, I'm like, oh man, cold. Can't they warm it up a little? Or maybe that would be off-putting, but still, cold instruments, eh. But anyway, so what happens? The speculum is there to hold open the vagina so you can obtain a sample. So this is what you call Pap smear. And what do you do Pap smears? Well, you want to check for cervical cancer. And as you can see, what we have here is cancer tissue. So what a pathologist can do is look at a Pap smear and determine, so pathologists are trained to know what normal cervical tissue and epithelia looks like. So if there's cancerous, if you have cervical cancer, these pathologists can look at this cervical Pap smear and look at the morphology and how it looks and determine if is there probable cancer at that point. So as you can see, normal cervix and dysplasia. So dysplasia refers to abnormal morphology of the cells and tissues in this area. So you can see that in this example, it's showing you normal, like cartoon of normal cervical cells. So a pathologist is able to look at a Pap smear and see if you have precancerous or precancerous cervical cells, and then work with the gynecologist to see, okay, what's the best way to treat and treat this cervical cancer or prevent the development of cervical cancer if it's precancerous. All right, so then we're at the vaginal canal and then the cervix, and now we're back at the uterus. Now the uterus is not just like hanging back. It's again, remember, it's kind of like actually leaning a little bit forward toward the anterior. So it's kind of like resting its head with the bladder as a pillow. So what we have here is, again, you have many ligaments that connect the uterus and anchor it. So it's not just floating around in the body. It's actually held very firmly in place. And you can see that the colon is in the back right here. The uterus is more toward the anterior and resting on the urinary bladder versus back toward the colon. All right, so this is another great example too. So as you can see, this is the front of the pelvic girdle, and you can see that the uterus kind of tries to anchor itself and hold itself against the front of the pelvic girdle. So again, another reason why during pregnancy, there's increased pressure on the bladder. Why? The bladder is up in front here, and the uterus is it's being sandwiched by both the uterus and the pelvic girdle here.